Hello, I am Nicol Voet. I am a physiatrist, rehabilitation physician and researcher working in Rehabilitation Centre Klimmendaal in Arnhem, the Netherlands, and in the Radboud University Medical Centre in Nijmegen, the Netherlands. And I will tell you more about exercise in congenital myopathies with the theme "Do as I say, but don't do as I do," because as a triathlete, I do not always the right thing in exercise. I will start at the beginning with my take-home messages. Talking about congenital myopathy in exercise, it's about start low and go slow. One size doesn't fit all. Context matters. Training is more than just exercise. And the last one, you have to listen to your body, but when you listen to your body, you have to listen proactively to your body. I will introduce you Hannah. Hannah is a young woman of 19 years old with a congenital myopathy. And she has a big problem because she has a high level of fatigue due to her congenital myopathy. But the problem is she cannot feel her level of fatigue very well. And as a consequence, she is overusing every day and she faints every day. And therefore she's not able to go out with her friends anymore, to study, to have hobbies, etc. And of course Hannah is very depressed. And Hannah is not the only one, because there are a lot of patients with congenital myopathy who experience pain and fatigue. Usually it's an indirect symptom, or in other words, not a direct symptom of the disease, but the result of a behavioral change. And not so long ago, it was recognized and acknowledged as a problem, as a very frequent and relevant problem. But what's the cause? Why is it an indirect symptom? You can see a model over here, a model of chronic fatigue in neuromuscular disease patients. You can see fatigue in the model. You can see that muscle weakness in the left upper corner is not directly related to fatigue. Or in other words, if you have a high level of muscle weakness, it doesn't mean that you have to experience fatigue. There is something in between, and that's physical inactivity. When you're not able to be physically active due to muscle weakness, you are at risk for chronic fatigue. It's called a perpetuating factor, a factor that makes that the fatigue doesn't go away. The second most important perpetuating factor is pain, and the third most important perpetuating factor are sleep disturbances. And with all this, just like Hannah in the right upper corner, you can have a low level of social participation. I already told you about acute pain, acute fatigue, and chronic pain and fatigue, but what's the difference? There's a time difference. When you experience pain or fatigue longer than 3 months, then you have chronic pain or chronic fatigue. And chronic pain and chronic fatigue doesn't always go away after rest, in contrary to acute pain and acute fatigue. And chronic pain and fatigue always is an unpleasant feeling. And the most important thing is that there is no relationship anymore between activities, rest, and the level of pain and fatigue. So it's very difficult to cope with. And these are multidimensional problems. So there are many factors underlying chronic pain and fatigue. One of these factors is fatigability. Fatigability means the amount of fatigue which builds up after activity. And there's a difference in fatigability between top sporters and patients with neuromuscular disease like congenital myopathy. Top sporters have a low level of fatigability, the blue line. And patients have a high level of fatigability, the red line. And a consequence is that the amount of activity patients can do is less limited than top sporters can perform in daily life. But they all have their household, their work, their hobbies, their family and friends. So that's a difficult thing, because you want to do the same activities as everyone else. But in the meantime, your fatigue builds up and acute fatigue becomes chronic fatigue, also because there is less time left for rest and for recovery. Happily, exercise can help. We know that exercise can help in diminished fatigue. And from the last years, the amount of evidence, scientific articles written about fatigue and exercise and neuromuscular disease patients is increasing rapidly. But we are not there yet, because this study from my colleague Erik Voorn from the Amsterdam University Medical Centre showed that there are still several problems in prescribing exercise in patients with neuromuscular diseases. On the one hand, clinicians have a lot of safety concerns. Almost 80% of them has a lack of knowledge about prescribing exercise, how to screen, how to dose exercise, and almost 50% of them is afraid of overwork weakness. On the other hand, patients, more than 70% of them is unable to perform the training level, which leads to a high level of poor motivation and fatigue. And I performed a lot of studies on fatigue in neuromuscular disease patients. In the first years, I focused on the effect of fatigue, on the effect of exercise on, for example, fatigue. But in the past years, I focused on the side effects and adverse effects of exercise, because they are at least as important. But what are side effects? Side effects are mild and temporary, just like the acute pain and acute fatigue. It goes away. It's, for example, muscle soreness, increased heart rate, shortness of breath, acute fatigue after exercise. But be aware, it can be more pronounced and have a longer duration and appear more quickly in neuromuscular disease patients than in people without NMD. And when you do not take these side effects into account, they can become adverse effects and will not go away. For example, when the recovery time after exercise is not taken into account, the exercise selection is improper, the contextual factors need a lot of energy, or the exercise intensity is too high. And before I go into detail in these factors, I will tell you more about different congenital myopathies. First, the LMNA variants. They have to be careful with intense or competitive sports, because these sports might make the disease worse or more quickly. And be aware that your body doesn't sense muscle stress very well, and this makes it harder to adapt and may increase the risk of heart problems like an irregular heartbeat or heart failure. And still, exercise can help. Gentle to moderate exercise, so not with a high level of intensity, but gentle to moderate exercise can still help. And if done with care, it can keep your muscles strong and work better. Then the TTN variants. In that case, supervised exercise can help, we know from research. Training at the medium level, also not too hard, will improve your heart and lung fitness. And good news, there's no extra risk of heart rhythm problems. And regular exercise didn't lead in studies to more arrhythmias. But still, you have to check your heart regularly with a cardiologist. Tests like ECGs, ultrasounds, or rhythm checks are very important to stay safe. Now let's turn back to the factors which can lead to adverse effects after exercise. First, you have to be aware that the recovery time is compromised and prolonged in neuromuscular disease patients. My colleagues from the Stanford University Medical Centre in the United States showed that the cardiopulmonary recovery, so the recovery of your heart and lungs after a maximal cycling exercise test in individuals with a neuromuscular disease, is compromised. So it takes longer time and isn't as well as in people without NMD. And you have to be aware that I will prescribe exercise to you, but your daily life is already top sport. When you're performing your household activities, when you bring your kid to school on a bike or walking, it takes a lot of energy. Daily life is already top sport. And you can see here cyclists in the Tour de France, and for them daily life is top sport too. But there's a difference. You can see that they do not have to drive their own car, they do not have to cook their own dinner, they do not have to make up their own bed. And one of my patients said, and I do not win a gold medal. But you have to perform top sport in daily life, and above that I will ask you to perform exercise. So be aware that you do not have enough time for rest. And that context matters. It's not only about the exercise, but also about all the things you perform in daily life. And you can, for example, get help from an occupational therapist to see if you can spend less energy in daily life so you have more energy left for your exercises. Because when you are not aware of daily life as top sport, exercise can lead to side effects and adverse. When you exercise, we can measure your exercise capacity during a maximal cycling exercise test. But the way we measure is a sum for the performance of your muscles, including your mitochondria, your heart and your lungs. But we know that the problem is inside the muscle. So therefore, we performed research during a maximal cycling exercise test in which we also measure your muscle capacity or your muscle fatigue. Because we know that muscle fatigue happens faster in people with congenital myopathy than in healthy people. And we know that during cycling and a cycling test, the muscles give up earlier than your heart and lungs do. In this study, we use special sensors, electromyography, to find when the muscles start to tire, start being fatigued. And as expected, these signals came earlier in people with several muscle diseases, which shows that their muscle fatigue quicker. And this can help us tailor training and daily activities better to avoid overuse or undertraining. And since then, I say to my patients, when starting exercise, normally you start at 50% of the maximum till 60% of the maximum. But there's a risk that you are cycling beyond your muscle fatigue threshold, so with a high risk of muscle fatigue and muscle pain, side effects and adverse effects. And since then, especially for people with a high level of muscle weakness, we say start low and go slow. When starting exercise, start at, for example, 30% of your maximum and build up very slowly. And what we see in our consulting room is that the level of muscle fatigue, the threshold, increases. So you are able to perform exercise and to perform your daily activities with a lower level of muscle fatigue when you start low and go slow. And this is not new because we already knew in, for example, Japan, it's called Kaizen. Kaizen is taking small steps and small changes. And performing exercise is a behavioral change. And your brain doesn't like behavioral changes. Your brain wants that everything is the same. And when you want to change behavior, your brain prevents you to change your behavior. But when you are taking small steps, for example, start with only 1 minute of cycling, your brain doesn't detect that as a behavioral change. And a couple of days later, it's 1.5 minutes and then 2 minutes, etc. And for example, you are at 20 minutes and then your brain wakes up and thinks, oh, let her go. And you've changed your behavior. And it's more easy to take small steps. And it's also better for your self-confidence when you are able to build up from 1 to 20 minutes instead of starting at 30 minutes and have to go back to 20 minutes. I already told you that the level of fatigability is higher in patients with congenital myopathy. We all have a 100% capacity. People without congenital myopathy can perform activities in their natural reserve with no time limit up to 60% of their maximum capacity. From 60 to 80%, compensation is needed. They have to do it in another way or with a limited time. And above 80%, there is a loss of function. It's not possible anymore. And the same is the case for people with congenital myopathy. But with a difference, the absolute values for capacity are less, as you can see here in the blocks. So, for example, vacuum cleaning, people without congenital myopathy can perform it in their natural reserve. But with a congenital myopathy, compensation is needed, which leads to pain, or you can do it only for a couple of minutes, or you are even not able to do it. I've told you something about aerobic exercise like cycling, swimming, walking, which can decrease fatigue. But there's another way of training, which is strength training. And recently, patients, physicians, therapists, researchers were all afraid of strength training because strength training for people with muscles which are weak, that cannot be the right way. But I have a lot of patients in my consulting room who perform strength training very successfully. And we interviewed these patients to see what are the 5 important pillars for strength training. And it appeared in these successful patients that balance is very important, to have balance in your daily life. So to have enough energy left for exercise, to have a sustaining factor, or in other words, something that makes you exercise for your whole life. For example, a friend which is going with you to the gym, a physical therapist, a swimming pool in the neighborhood, etc. Then you have to have control, a feeling of control, a sense of control of the things you are doing. And sometimes you have people who want to write their training schedules, training schemes themselves, and sometimes people want to have a physical therapist who guides them. And it's very important to be aware to which group you belong. Is it to the group who wants to perform it themselves, or the group who wants to have guidance? And we also interview patients who were not able to perform strength training, and there was a mismatch in that group. People who want to perform exercise themselves had a very strict physical therapist, and patients who had less self-confidence didn't have any guidance at all. Then daily life, it's also about a good night of sleep, healthy food, feeling well, that's also very important. And strength training has to be personalized. So what's your goal? What do you want to achieve with strength training? What do you like, etc. Now I will tell something about peripheral fatigue and central fatigue, because it's very important to know the difference when you want to exercise. Central fatigue is the fatigue in your brain and nervous system. When you're tired, your brain sends weaker signals to your muscles. This can happen due to a lack of sleep, stress, long-lasting effort. It's like your brain saying, let's slow down. And you do not want central fatigue during training, because then the training is not so optimal. And your brain prevents you to exercise. It prevents you from getting stronger. And therefore daily life is so important, to have enough rest. Then there is peripheral fatigue, which is inside the muscles, which happens when your muscles run low on energy or build up waste like lactic acid. And as a consequence, you feel that your muscles become slower, weaker, a bit painful. It feels like burning or heavy limbs. And it's no problem, but not longer than 24 hours after your exercise. And it's not always needed, burning or heavy limbs after exercise, to have effect of your exercise. And this helps you get stronger. However, be aware, start low and go slow to prevent compensation. I will come back to compensation later on. I already told you that exercise has to be personalized. So be aware, what is the goal of your exercise? What do you want to achieve? And this video shows you why it's so important to fit your exercise to your goal. You can see an elderly man over here lifting up a very, very heavy kettlebell. But why is he doing these exercises? Why isn't he performing exercises on an ergometer? Cycling. And this video shows you why. Because he has a certain goal. It's Christmas and his granddaughter visits him, and what he wants to achieve with his exercising is lifting up his daughter to the Christmas tree, and therefore exercises. Fit to his goal. I already told you have to prevent compensation. But what is compensation? When your muscles, especially the muscles which are more weak, are not able to perform the exercise anymore, then your brain activates other relatively more strong muscles which take over the exercise. And you can see that, you can detect that because of a change of movement. Here in this video you can see people who run a marathon, and you can see that they walk down the stairs in a different way because, and this man had run a half marathon I think, because their calf muscles are very, very painful. They are fatigued and the brain wants the calf muscles to rest. So it sends muscles to the relatively more strong muscles, and therefore there's a change of movement. But it's no problem when it's only one marathon in, for example, 4 or 5 months, but when you perform this every week or weekend, then there is a problem, because compensation leads to disuse of the weak muscle and to overuse of the relatively more strong muscle. So I've already told you that fatigue leads to compensation and a change in movement. You can see athletes here at the left side with a perfect technique. And you can see triathletes, 2 brothers, and you can see that the left brother has experienced less fatigue than the right brother. Now let's turn back to Hannah. Hannah is very happy because she gets a helping assistant dog. And this dog barks to her or is sitting in front of her when he detects her fatigue. And I saw Hannah again during the COVID period, and Hannah was wearing a mask. And the dog was trying to pull away her mask from her face. And Hannah said, I think it's my smell. My fatigue is in my smell. But I thought that, take a look or think back about the triathletes, the dog can see her fatigue in her face. And Hannah never fainted again. So what we wanted to do is to detect muscle fatigue by measuring compensatory movements during exercise. So what we did is we performed again a maximal cycling exercise test with EMG to measure muscle fatigue, but also with motion analysis to measure muscle coordination. And what we saw during the cycling test was that indeed when the muscle, especially the weak muscle, becomes tired, the brain detects the tired muscle and activates other relatively more strong muscles to compensate a change in movement. We also perform these measurements during walking, EMG measurements and motion analysis, and we ask our patients to scale their level of fatigue from 0 to 10. And what we saw was that they didn't feel their level of fatigue very well, because we already detect muscle fatigue with EMG and motion analysis, and minutes later people detected muscle fatigue themselves by scoring their level of fatigue. So be aware that when you listen to your body, it's not very reliable. You don't always feel your level of muscle fatigue very well. But with these measurements, we are able to detect muscle fatigue in real time, and we can help people coping with their muscle fatigue in daily life. So we are now developing a way of measuring muscle fatigue in daily life, which is more easy. And be aware that one size doesn't fit all, because every patient in that study had a different compensation technique. So there's no one compensation technique for all these patients. Then some last words about aids, like for example arm support. Here's a boy with Duchenne muscular dystrophy. We performed a study in boys with Duchenne muscular dystrophy, and we measured their level of muscle fatigue with and without arm support. And it appeared that when they use arm support, they can move their arms for a longer period and with less muscle fatigue. So don't be afraid that you become lazy when you use arm support or orthosis or a walker. It's the other way around. It helps you be more active and to activate all your muscles without the risk of compensation and disuse. So I already showed you that you're not able to detect your level of muscle fatigue very well. Or in other words, you do not have a dashboard. And at least in the Netherlands, when you drive on the road in a car without a dashboard, you are taking off the road. So we are now busy with developing a kind of a muscle watch and a training passport. So to help you detect your muscle fatigue in daily life and to exercise and be active in daily life safely and with the highest possible effect. So to summarize, when exercise, start low and go slow. One size doesn't fit all. Fit your exercise to your goals. Context matters. Have the right balance in daily life. Training is more than just exercise. And when you listen to your body, you have to be aware that you have to listen proactively to your body. Thank you very much.